Can you plug in the shaver for me? Hi, this is Dr. Buford. We're just getting started on the right shoulder. We're looking from the back to the front. We're going to be putting a stitch in the biceps tendon through a spinal needle and using a free number 2 hi-fi suture to secure the biceps. That's called the tenodesis. And right now we're just looking at some of this torn labral tissue. And using the shaver that you see on the screen to just debride some of this tissue. The next thing we're going to need will be that spinal needle and the shuttle relay and the hi-fi suture. Here's the torn rotator cuff tendon. I'm going to sneak around this torn biceps tendon to show you. So this is all torn rotator cuff right here. Okay. And this is torn biceps tendon. Let me come around the back side of the biceps so you can see a little clearer. So what I'm pulling down, that's torn biceps, and it's torn pretty well. We're going to put a stitch in it just to try and do a little bit of a tenodesis, but it's already pretty much released itself from inside the joint. In terms of the rest of the joint, we can see that there, hold this shaver please, reach underneath. We can see that the glenoid down below looks like it's in pretty good shape, not much arthritis. Posterior capsule here looks good. Posterior humeral head looks pretty good, not much loss of cartilage, and there's the hole in the tendon in the rotator cuff. So the next, hold the camera there. So the next thing we're going to do is take a spinal needle, try and pass this through this torn biceps, again, just to try and get a hold of it. There it is coming through once. We'll take a grasper. And we're going to reach in here in just a second, grab the black wire. We're going to load that with a suture. There we are, pulling that through. We're going to do the same thing one more time with that spinal needle. You can see we're trying to come through a slightly different area, about like that. We'll feed that relay through again. And then once you get enough of that through, we'll grab it one more time. We'll back the needle out. Now the trick here is that we're not going to pull it straight through that great cannula. We're going to sneak around behind the biceps here, like this, and retrieve it right here. That's going to give us a little stronger hold on the tendon in case we're able to do a tenodesis. So there you can see, now I need a pair of scissors. So there you can see we have a strong hold on the biceps. You can see the sutures at the top of the screen there going out. And we're going to go ahead and cut the biceps at its base now. And then after this, we're going to get to work on the rotator cuff. So here's a pair of scissors coming in. And now the biceps is released, and that won't grow back, so that takes care of that problem once and for all. Here you go. We'll use the straight crescent first. And so now we're going to come back in with our shaver here and just make sure there's nothing else loose here or that we can smooth out so that it doesn't catch inside the joint. We're going to go off on the video. The next time we come back up on the video, we'll be in the subacromial space, working on any bone spurs and getting our first good look at the tear in the rotator cuff tendon. Okay, so this is the tear in the rotator cuff tendon. We can lift up, you can see the joint down below. The front of your shoulders to the right. This is all the hole. And if we bring in the shaver, or just give me the, yeah, sorry about that. We're just going to show you something else here. As we look towards the back and lift up, you can see this tear is kind of delaminated. There's a couple different leaflets to this tear. We're going to connect all that back together. Okay? And so the first step is to take a spinal needle and we're going to plan our repair. So it looks like we're going to have to place 2 suture anchors. We're going to place one right here and a second one probably more anterior. Your biceps tendon is going to be way up there, but the first anchor is going to go down. Looks like it needs to go down right about here. So we'll take a scalpel, we'll make a little nick in the skin. Go ahead and pull the and that allows us to place a guide down, which we're going to show you here in a second. Hold the camera there for me, please. You got it on the screen? So there's our guide. Once again, we're going to lift up, make sure we understand the tear pattern here. And we're going to place our first anchor down right about here. So go ahead and pull the, and put the anchor in. And now we'll just gently tap this down into the bone. Okay. And then we just unload the anchor, or unload the inserter by pulling back. And we pull out the guide. And that gives us 3 sutures to work with right there. That's very solid. So now we're going to take a crochet hook. We're going to bring that in from the front of your shoulder, which is the right side of the screen. And we're actually going to work with this solid blue suture first. So we'll pull that inside. We'll take a grasper in the front, so grasper to girth. From this cannula here, we're going to pass our suture. Put that in the front. So here's our suturing device. Hold the camera here, please. And then I'll take that. Got it? So 2 hands on this so you can hold it stable. I need to reach in and make sure I get this deep layer. This is real important as part of the repair. So there I've got the deep layer. We're going to hold this here. Let me take it for a minute. Okay, so we're going to hold this about like that. About like that. I'm going to make my first pass through the tendon. Now follow me. Pull back a little bit. There we are, coming all the way underneath. That looks pretty good. So we'll go ahead and feed the relay. Retrieve it, and then we're going to load that with that blue stitch. So we'll go off on the video, show you some more in just a minute. But here's the stitch that we've just made, so you can see it. Down through there, loaded here. So we're going to go ahead and load that. Okay, so we've got the first suture tied. You can see the cut edges right there. You can also see how that's helped to start to close this hole. We're going to take another suture now. We'll take the solid, or I'm sorry, the black and white striped one. You can see how we pull that through just like that. And now we're going to take another hook. We'll take a grasper in the front to Garth. Turn to the right to me. Got it? So here's my hook. We're going to come through right about here. Hold the camera here, please. And just push in just a little bit so you don't come out. Just like before, we're going to try and get underneath here and make sure we get this deep layer. Okay, pull right about there. So now we're going to come through. There you can see us right there. We'll feed that through. And then we're going to pass and tie that just like the other one. Okay, hold this. Okay, so now we're going to pass our third suture. This will be the final suture from the first anchor. You can see we've passed the second one, the black and white one, but we haven't tied it yet. So we're going to reach up, lift up on the cuff. We want this deep layer just like that. We're going to pull that this way. That's the blue and white, the black and white stitch. We're going to pass this one right about here. And in just a second, we ought to see that popping through. There it is. Okay, and we'll feed that. That looks good. Okay, so we've got all three sutures passed. We've only tied one of them, though, so far. And now we're going to place our guide again. Here it is. We're going to place a, go ahead and pull it. We're going to place a second anchor right about here. And then we'll tap gently initially. Keep going, all the way down now. Okay. And now, just like before, we're going to unload it. We'll pull out the guide. We'll seat the anchor. And that looks good. And so we're going to go ahead and pass a couple or all three of these to take care of the rest of this tear. Let's see if we can't decide which colors. We'll go off in the video, show you some more in a minute. Okay, so now what we're going to show you is we're going to tie these one at a time. We've already tied the very, very first one, but now we've got 5 more to tie. So the next one in line is this black and white striped one. That's this one right here. So we're going to tie this one next. You can see the rest of them just lined up ready to go. Okay, we're all done here. We've got 2 suture anchors in, a total of 6 stitches to repair the cuff. The hole that was in the tendon was right there. It's gone now. And the biceps tenodesis suture is right there in the front. So that looks really good. We've got, I think, a stable repair on the cuff. Everything's moving together as a unit. And we're going to get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.